Let's start by talking about something that inflicts millions of Americans, migraine headaches. If you're one of these people who suffer from migraines, you know they are incredibly painful and they can wreck your entire day, your entire week. They can keep you in bed, and even if you're strong enough to power through them, they absolutely impact the joy you get out of life. And if you've had these headaches for any length of time, you're probably on medication to manage the pain, and you were probably told that there's no cure for your headaches, and the only thing that can be done is to take medicine, but even then, it's just to manage the intensity and the frequency of the headaches. If this is you, please listen up. I'm about to share something with you that could completely change your life. This is not an exaggeration. In my practice, I see this happen with a high percentage of my patients, and I'm about to describe the difference between what you've been told are migraines and what we call cervicogenic headaches. Hi, I'm Dr. Charlie Oliver, and if this is your first time to the channel, welcome. I'm a chiropractor and physical therapist practicing in San Antonio, Texas, where my tagline is we combine the best of both professions to help people live pain-free. This channel is all about giving you, somebody who's struggling with pain, new perspectives and treatments from both a chiropractic and a physical therapy viewpoint. All right, let's jump into this. I mentioned the term cervicogenic headache. Many people have never heard this term before, and so it may even be new to you as well. So what's this mean? Well, cervico refers to the neck and genic means originating from. So cervicogenic headache means a headache originating from your neck. And here's a part that could change everything for you. What you think is a migraine, something you've been told there's no cure for except medication to manage it, could actually be caused by issues in your upper neck. Yes, it could be treated by chiropractic or physical therapy. Sounds too good to be true? It's not. Now, let me explain the connection here. This is where we're gonna nerd out a little bit, so get ready. The nerves that give sensation to the sheath around your brain, they converge into the brain stem, but they also converge into the upper part of the spinal cord at the same level as the nerves that give sensation to your upper neck muscles and joints. The technical term for this structure is the sensory nuclei of the trigeminal nerve. You can impress your friends and family by telling them this juicy nugget if you want to, but here's the thing. What this means though, is that when there's tension, stiffness, or misalignment in those neck muscles or in the joints, the signals they send to your brain can make you feel pain above the eye, behind the eye, or on the side of the head. Now, I want you to let that sink in for a minute. Yeah, problems in the upper neck can cause you to actually feel pain behind the eye or above the eye. No one in my practice has ever heard that before. They think that they've got migraines, period. That's why so many people think that there's no fix for their problem, and they a lot of times don't even come to see me for that problem. So now, how can you tell if your problem is a true migraine or if there's a cervicogenic component to it? Let me walk you through a couple of easy tests for that. First, test your neck mobility. Can you turn your head fully side to side? What about bending forward and backwards? Do you have full range of motion with zero pain or stiffness? Or do you get pain? Do you get tightness? Do you get stiffness or have limited motion? If so, that's actually good news. It means there could be a connection between your neck and your headaches. Second, I want you to lie down on your back to relax your neck muscles. Next, press with your fingers into the muscles at the base of your skull. Is it tender on the side where you get the headaches? If it is, that's a huge clue. Often I'll ask my patients, so is it tender on the side where you get your migraines? When they make that connection, it's like a light bulb goes off. So this is what I really hope for you. I hope your headache is cervicogenic because that means there's hope for relief beyond just taking medication. From here, we know there's a high chance you can be helped. In some cases, we can eliminate the headaches entirely. Other cases, we can at least decrease the severity of the headaches or reduce the frequency of them. There's a relationship too where you may have true migraines, and technically we can't fix those, but many times a neck problem actually triggers the headaches, so we can at least help manage symptoms. Treatment in chiropractic and physical therapy is similar in that we need to address stiffness or loss of mobility in the upper neck vertebrae and where the skull connects to the top of the spine. This is a top priority. Secondary to this, we need to work out trigger points and muscles below the skull, in the jaw, and even in the lower neck and the upper back. Please share this video with anyone you know who suffers from headaches. This isn't common knowledge, but it absolutely should be. And if you got value from this video, hit that like button and subscribe to our channel. We're posting new videos each week to help you live a pain-free life. As always, have a wonderful day and see you in the next video.